DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for tuning in to Doc Talk. We're going to have a great show. We're going to talk about bovine respiratory disease, metaphylaxis, BRD treatment, and much more with Dr. Deana Hardee from Merck Animal Health. It's going to be a great show. Stay tuned. We'll be right back.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thomson. I'm here with Dr. Deana Hardee. And Dr. Hardee is a technical services veterinarian for Merck Animal Health. She is a wealth of information. For us in our practice, all of our veterinarians lean towards Dr. Hardee to learn about feedlot medicine, about stocker medicine, BRD, and much, much more. So we're very, very thankful to get you on the show.
Thank you, Dr. Dan. I appreciate that.
It's great. And so today we're going to talk about bovine respiratory disease and treatment and control and all those good things. But I probably just ought to define the problem.
Yeah, no, and I think we've probably chatted about this before, at least touched on the subject, but it is a little bit of a passion of mine. So why do we spend so much time talking about BRD or bovine respiratory disease? It's important. It's critically important to our industry. It's economically important. And arguably, it's probably the largest sickness or illness, right, that we deal with. For me, BRD sounds like it could be a simple disease process, but as we continue to learn more and more about it, we know it's not. It's truly the BRD complex for a reason. And so I like to break it down, and instead of just thinking about one single pathogen or bug, I like to consider those pathogens and bugs, as well as each individual animal or group of animals, and then the environment that we have our cattle in. And so when you think about all of those things working together, BRD really is multifactorial. It's complex. So I think most of us probably vaccinate for BRD in some degree, or at least I hope so.
Yeah,
there's both viral, right, and bacterial challenges that we face with BRD. So you have both of those issues going on potentially. And to top it off, those bacteria, just like staph on our skin, they can be commensals of that upper respiratory tract, just hanging out, waiting for an opportunity to wreak havoc in the lower respiratory tract. So that's when we get those viral challenges, maybe stress from shipping,
Yep.
weaning, or environmental stresses like just weird weather, right?
Yep.
And then combine that with the animal itself. That animal may be immunocompromised, maybe it didn't get maternal antibodies to an adequate level, maybe it's heavily parasitized. Again, stress, we've grouped it with the other cattle. We've got some social hierarchy things going on. So all of that together really makes that BRD complex truly a multifactorial complex disease process.
Yeah.
And very important for our industry to think about.
Yeah, we would say probably half of our death loss in the feed yard is BRD.
I think that's more than fair.
Yeah, and so, when you're thinking about something, I know we get off on these little tangents and chase rabbits and stuff in feed yards, but when it comes to it, the BRD is the disease that causes the most havoc and death loss in feeder cattle.
Yes, sir, in feeder cattle, but even in your stocker segment and down to the cow-calf level, I see quite a bit of summer pneumonia, even so. So again, I think it's kind of throughout the entire production phases, but certainly in that feedlot phase, there's quite a few things we can do to try to prevent and mitigate BRD and disease challenges. But certainly it's still a problem and an issue in our industry.
Yeah, and so as we go through this, we're going to talk about controlling it. We're going to talk about treating it and different things to kind of help those animals not succumb to BRD.
No, without a doubt. So anything we can do to try to mitigate that challenge up front, and it really starts at the cow-calf level, I think is critically important as we think about this for our industry and for the calf. It's the right thing for both.
You got it. We're going to take a break. When we come back, more with Dr. Hardee. We're going to talk about bovine respiratory disease and its treatment and control. Thanks for watching DocTalk. Hey folks, Dr. Dan here. Welcome to Cattle Intel by Neogen. We're going to talk about cattle footing. And when we're talking about footing of cattle, we're talking about how do we help provide cattle a place where they feel calm and where they don't get injured. The big thing is that when surfaces are icy or when they're slick, cattle increase their alertness because they have to move sooner to avoid a conflict or something, an interaction with a human being. The other one is if the surface is too rough, then that surface can cause toe abscesses, which don't show up for another 20 days until after you've worked these cattle. But making sure that you have proper footing, proper surfaces, and places where cattle can get traction is vital to helping cattle move safely and calmly through your cattle working facility.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Deana Hardee, and she is a technical services veterinarian for Merck Animal Health. Great practitioner, incredible bovine veterinarian, and so we're very thankful to get her on the show and talk about bovine respiratory disease. And I guess we've talked about what the problem is and what it causes. Now, how do we prevent some of this from happening?
Yeah, so I break it back down into my three groups, right? At an animal level, we got to make sure that calf is ready to go to the next phase of production. And that really starts, honestly, with mom. We need a well-vaccinated cow herd to lay down great maternal antibodies to get that calf set up. Then I like to talk about the basic vaccine structure for a cow-calf herd, right? It's not complex. We probably make it a little bit harder than we should as veterinarians, but 2 quality rounds of viral vaccines, plus or minus that bacterial component, and clostridial vaccines, so while we got them in the chute or on the calf table, I think really sets a calf up for success. And note I said quality round of vaccines. I don't necessarily mean vaccinating as they're running on the truck to go to the next phase of production, or I don't mean some vaccine program that we haven't thought through, or maybe we inappropriately handled our vaccine or our animal health products, but a quality round of vaccines to get that immune system ready to go. But the other part of that really is the environment and what we do these calves. And I think undoubtedly our system can be a little bit stressful. And I think as good stewards of what we do, part of that is mitigating the stress of weaning when we can, whether that's fence line weaning, different apparatuses on the nose, etc. All the way through how we ship, haul, our planning, extreme weather events. Some of that we have control to work around, right? We don't have to work calves when it's extremely hot or extremely cold, or ship and haul the same degree. And then also when we receive calves, I know I've spent a lot of time talking with you about this, and you do phenomenal presentations and talks on this, but a lot of calves, when they get to my side, into the feeding phase, they've never seen a bunk before.
Right.
They've never seen a trough before. So anything we can do to precondition or pre-expose them to that, I think is critically important. I think the component of all of this, and I guess shameless plug, is a veterinarian and having a solid veterinary client-patient relationship, or a VCPR. And more and more, it's harder to get antibiotics, right? And having a vet that's not just your emergency vet, but someone that knows your operation, that can help you set up these very routine protocols and maybe think through things that you didn't see because you're on your place every day. It's such a valuable tool, and I think something that we certainly don't talk about enough.
Yeah, and the working with your local veterinarian, they see all the herds in your region. They know what diseases are endemic, and they know the vaccines, beyond the core recommendations.
Exactly.
There's just little nuances of working with that medical professional that you just can't get anywhere else.
I completely agree. Anything that they can do to help you, again, do the right thing for that calf and the right thing for the industry as we think about it, moves to the next phase of production, is valuable. It's a valuable tool, like I said, to have on the farm, just like that medicine in a bottle. I'd say the mind of the veterinarian, it can be as important or more so in most cases.
And so, we talk about telemedicine. We've been doing telemedicine since we've had a telephone.
Without a doubt.
And so call your veterinarian, use your veterinarian, work with Dr. Hardee. All of this is just part of never quit learning.
Exactly.
Great. We're going to take a break. When we come back, we'll talk about metaphylaxis. We're going to talk about treatment and much more with Dr. Deana Hardee.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Deana Hardee, and we're talking about bovine respiratory disease. Dr. Hardee is one of our industry and profession's best when it comes to this topic, and we were fortunate enough to get her to slow down just a minute to come be on the show, which we're very thankful. She's a technical services veterinarian from Merck Animal Health and helps many veterinarians and producers like myself deal with different outbreaks and that. But we're going to start off with the longest word we use, I think. One of the longest is metaphylaxis.
Metaphylaxis, yes, sir. So we've been talking about BRD and kind of leading into this. I feel like we can't have this conversation without talking about metaphylaxis and defining it and understanding what it means. So some people refer to it as mass medication, but it is an on-arrival antibiotic that's given to try to mitigate the risk of BRD. Again, our production system's stressful. BRD is complex. I think we've highlighted that. And so it is such a valuable tool that, again, I want to reiterate how important it is to be judicious and to work with a vet. But as a producer, as a veterinarian, having owned cattle, it is something that I think we don't talk about enough, and as an industry need to understand that value and what it does for a calf. I also think we don't do a great job lining up expectations either. And so certainly metaphylaxis should not be a crutch for animal husbandry. It should not take the place of good management in animal husbandry, but in certain situations, it is really important and something that's the best thing for those animals.
Yep, and I liken it to an implant, right? We have the best genetics and we have the best feeding program. Implants still have a positive effect. And when we have the same thing on doing the best things we can for these calves and the best feeding program and platforms, metaphylaxis still, it just takes you to another level.
Without a doubt. And I really like that analogy to the implants. It's certainly something that our industry's researched heavily. I rely on meta-analysis or systemic reviews, so basically taking all the data that's out there and analyzing it. And over again, metaphylaxis is so important for especially those high-risk commingled calves that maybe we don't have a vaccine history on. They're not a single source ranch origin. They've traveled potentially a long way to get to where they're going. And that tool, again, it's not only economically advantageous, but I think it's the right thing for those calves in that situation, because their risk of BRD is so much different than that single source ranch calf that's driving 30 minutes down the road.
Yeah, and we see it. We see a positive response in decreased morbidity, which then leads to the decrease in mortality. And whether or not, I mean, right now in this market, and what these calves cost, and what 1% or 2% death loss costs us. We can talk about all we want about the economics, but it's also a welfare tool.
Without a doubt, something that I think you just said it best. It's a welfare tool that also reaps rewards when we think about closeout information as well.
Yeah, there any doubt, and there's nothing much more predictable.
And without a doubt, and that's something that I think metaphylaxis lends us to be able to do, is to better level set. To maybe establish some expectations when we know calves that maybe have a history that we're just not aware of.
Yep. So I'm assuming that Merck has products then that are placed in this metaphylactic class that are used routinely.
Yeah, so when you look at an antibiotic label, it's going to say either for treatment or for control, or it may say both, for control and treatment of. At Merck Animal Health, we have two products in our portfolio. They're both in what we call the macrolide class of antibiotics. One is Ziprevo or tildopiracin, and the other is Araven, a tulathromycin. So both of those fit really well into that metaphylaxis slot. Certainly, though, work with a veterinarian to establish what a protocol should be. Set an appropriate interval from when you give metaphylaxis to when that animal can be pulled again. We often call that the PMI, or post-metaphylactic interval. And my favorite line that I may get to say again in this show is, you can't manage what you don't measure. So understanding when you give that you should be able to have some measurable differences in those health outcomes, morbidity, mortality, and reevaluating that with your veterinarian to make sure that you're still using the appropriate drug, I think is critically important.
Excellent. We're going to take a break. When we come back, we'll talk about treatment of BRD with Dr. Deana Hardee.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson here with Dr. Deana Hardee. She's a veterinarian for Merck Animal Health. She's a technical services veterinarian. Spends a lot of time working with feedlots, stockers, and kind of do you have a region or that you work with, or are you just kind of?
Dr. We kind of go where they tell us and where we're needed. But I'm based in the Texas Panhandle, but grew up in South Georgia, so still have some ties, roots there, and spent most of my time in practice in Central Nebraska. So I enjoy being able to see lots of diverse operations and all really segments or phases of production.
Everything from farmer feeder to big feed yard to stocker cattle to corn stock, everything.
Yes,
You've
sir.
seen it all. That's great. That's great. That's great. Well, I'm not surprised. You've wealth of information for us. And we very much appreciate it. But let's talk about, treating these calves for BRD.
Yeah, so we already spent a little bit of time referring to metaphylaxis or the on-arrival antibiotic. And then certainly you can elect not to do that. And in some cases, that's completely necessary and maybe a direction that you should go depending on the risk class of cattle. But sometimes cows still get sick despite being a lower risk animal, being well vaccinated. And so when we talk about treatment, there's, again, multiple different classes of antibiotics. I like to think of them kind of as families. Within those families, there are different antibiotics or trade antibiotics, trade names that you and I may know that are also more like siblings, if you will. And so I always say work with a vet to make sure you understand what class of antibiotic you're using.
Yep.
Because sometimes if it's, say, a soft tissue injury compared to BRD, there may be one antibiotic that excels in certain arenas. So again, treatment is for BRD is very important, but really defining and understanding what treatment is you're going to use and what that treatment protocol is going to look like is something working with a vet is really important.
Yep. And when we have certain classes of compounds, kind of like you're talking about the different families, if we have certain classes that are used routinely for metaphylaxis, coming in with different classes makes some sense, right? For when we treat for animals that eventually do succumb to BRD.
Intuitively, I think we knew that as an industry, but at Merck Animal Health, we've recently done some studies to really look and define that. Admittedly, our product portfolio includes two classes of antibiotics, so we're always looking to see the best place to utilize those antibiotics and where they fit together. And so for us, we realized in high-risk cattle, using a macrolide, for example, on arrival, lended to using a phenocol, or in our product portfolio, fluorophenocal, which is Nuflor and Resflor, in that first treatment slot. And from a pharmacokinetics, pharmacodynamic standpoint, it kind of makes sense. We know that antibiotic, that Nuflor and Resflor, can get into damaged lung tissue. And so I've always liked it as a treatment option. These studies have shown that the data would also follow kind of our bias on using that as a treatment option.
So using like a Nuflor, Resflor, following metaphylaxis, it showed some decrease in case fatality rate, decreased mortality.
Yeah, case fatality and overall mortality and BRD mortality. Yes, sir. Now, certainly, you could even apply that and move it into an animal that didn't receive metaphylaxis. And despite our studies not doing that, there's other data out there that would suggest following a pretty similar protocol. But that, again, working with a vet is so critically important, both establishing what antibiotics to use and then that interval between treatment. Because I see the biggest failure, people thinking that the antibiotic doesn't work or overdosing or retreating too soon. And admittedly, we don't do a great job explaining this, but we need that calf to not only help, or the antibiotic to help it start to kill or slow down the growth of bacteria, but we need that calf's immune system to then kick back up. So really, when we're giving an antibiotic, we're asking that calf to respond, not to the antibiotic, but giving it an opportunity for its immune system to come back and actually be 100%. So again, I don't think we level set that enough within our industry, but treatment sometimes is unfortunately something we have to do.
I remember some of my managers always saying they wish they had chloramphenicol back, and I have to remind them that fluorophenocal has like 50 times the affinity for those receptors on bacteria than what the old chloramphenicol had.
That's what they tell me, and thankfully it's not using the human side, so we're excited to have that in our portfolio.
It's a great group of products. We use them all the time. Thanks for spending time with us on the show.
Right, thank you.
Thank you for watching DocTalk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson with Dr. Deana Hardee, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.